Well, good morning, everybody. Hold on, I'm sorry. Maybe I came up on the wrong side of the stage. Well, good morning, everybody. Okay. This is Georgia, Georgia. So I'll stop there. I'll hold my comments because somebody said they're going to yell at me if I didn't. So let me just share a couple things with you since many of you don't know me. I was born and raised in South Carolina. I'm the son of the late Murtis and Nathaniel Harper. I spent 4 years in college at the Citadel, the military college of South Carolina, so where I get my discipline and structure, and being here at 6:30 in the morning comes from my time at the Citadel. And then I spent 8.5 years on active duty in the military. I got married at Fort Gordon, Georgia. I served at Fort Gordon, Georgia. My first child was born at Fort Gordon, Georgia. So I'm part Peach State, okay? And when I had the opportunity to come back here with Kaiser Permanente, I said yes, before they even offered me the job. And it's because of the people in this room, but it's also about the possibility and the greatness of this great state. So I have a few comments today, and I'm not going to keep you long because I want to make some friends. So if I give you time back, I do have a challenge that I want to issue to you. So those students, could you raise your hands again? All right. So students, this is the test. I want you to record at least 5 people shaking your hand, talking to you about your career and your future, because somebody did that for me 39 years ago. So let's give these students a round of applause again, okay? So good morning, colleagues and committed servant leaders of impact to our communities. It is an absolute pleasure to join you today at the 2025 Health Connect South Summit, a timely and vital conversation about how we can strengthen health and well-being for our respective communities, the region, and beyond. I want to give a special thank you to Health Connect South. And I want to pause there for a second because when you're asked to speak, it becomes a stewardship responsibility of the organization which you're speaking to. So I want to say to Russ, God bless you, Russ, for your great leadership. To the board and to the staff, well done, thy great and faithful servant, because you've lived out your fiduciary responsibility of loyalty, care, and obedience being a board member. So let's give them a round of applause. So on behalf of our chairman and CEO, Mr. Greg Adams, Kaiser Permanente is thrilled and honored to be here and serve as the presenting sponsor. But that presenting sponsorship role also carries a level of responsibility to role model behavior, but also support all the other sponsors. So many of these sponsors are our partners. So I want to give all the sponsors a round of applause and thank you for giving, and please continue to give in the future. Thank you. The collective power of servant leadership is something I learned in my days in the military and at the Citadel. The idea that leadership is not about position, but about service, purpose, humanity, humility, and putting people first. Will propel the state of Georgia and the Southeast to become a beacon of hope and also prosperity in the communities that we serve. Also, as a true leader, I want all of us to think about this, we must be able to understand the people around us and understand their stories. So I'm going to share a little story with you, and to all the students, here's your homework assignment. That means everybody in the room, so please jot this down. So how many of you know what an ICD-10 Z code is? Raise your hand. Less than 50% of the room know what an ICD-10 Z code is. So let me just share with you, over the last several years, I've had the blessing and the honor of honoring my mother, my father, and my mother-in-law all the days of their life, so that my life shall be long. And I've discovered that one of the biggest challenges in American healthcare is how do we take care of our family members and the elderly. And an ICD-10 Z code, and I'm going to list them off for you, Z74, Z74.01, 0.09, Z74.1, Z74.2, Z74.3, Z74.8, and Z74.9 are all focused on care provider dependency. It broke my heart when I saw my mother's mobility go from 100% to 0% because of her overall clinical condition. It broke my heart when my mother-in-law was lost to continued care when she passed away from cervical cancer. With us having the resources to MD Anderson and Kaiser and Oster and everything else, there was a point where I had to ask for help because I couldn't do it myself. So the first homework assignment is find somebody to help you. Because at the end of the day, we all will need help as we discover the challenges of healthcare together, but come up with joint solutions. So to that end, Kaiser Permanente exists. Our reason for being an organization is to provide high quality, affordable healthcare services to our members and the communities that we serve. And we know that this truth better than anyone else because communities require more than just medicine. It requires innovation, technology, focus on desirable collaboration and partnerships well beyond the hospital and the clinic. And I just want to also say that Kaiser Permanente is now in 11 states plus DC area because we just announced that we're in the great state of Nevada now. And we're going to continue to look to partner and expand because people are asking to know more about our value-based care delivery system, and more important, our integrated care and coverage model. And the irony of it is this is being celebrated during Kaiser Permanente's 80th anniversary of existence. And I want to recognize our founding fathers of Henry Kaiser and Dr. Sidney Garfield. And Henry Kaiser being one of the greatest industrialists in the world, he built ships, he built cars, he built tanks. And if you ever go to California and you want to go to Richmond Harbor, you get a chance to stand on one of the Liberty ships, which was built in 45 days. Wow. You can do the research. It's not just on Wikipedia, it's there. But my point is, how was it possible that someone and their team built a ship that went from the Richmond Harbor to the Philippines to carry munitions in 45 days? That was a lot of collaboration, a lot of hard work, working together, taking the best of everybody there. So I encourage you, do your history because others have done great things. Now, as we think about this, and Kaiser celebrating its 80th anniversary as an organization, here in Georgia, we're celebrating our 40th anniversary. And if there are Kaiser members here, we're here to serve you. If there are Kaiser employees, past and present here, I thank you. Because one of the things that Kaiser has done over the last 20 years is given over $1.5 billion to the communities that we serve. Because we believe that you can't just talk about it, you have to lead and be about it. And Kaiser Permanente is committed to do that in partnership with many, if not all of you going forward. So we know that health does not just come from what happens inside the exam room, it comes from what happens in the conditions in our respective communities, which are all wrapped in the social determinants of health. And as a nonprofit organization, we realize that stewardship, what it means to us, using our resources wisely to make the greatest impact for people and communities and also exhibit great corporate citizenship. And now as we pivot and turn to this wonderful conference, again, I want to thank Health Connect South for bringing us together to talk. And so here is my charge to you now, and I'm going to finish in a second. My charge to you is to get to know 3 to 5 people at the break, because we're going to do a break after this. I want you to talk to them and ask them, what problems are you trying to solve? Let me just let that sink in for a second. Because many times we go to people with our solutions before we ask them, what problems are we trying to solve? And the next question would be, how can I help you solve them? I got a Somebody must have been to church over the weekend. We are in the South. I got to just say that. If I get a well right now, I'm in trouble. Oh, boy, here we go. There will be no collection, okay? I promise you. But I'm very serious about this. I'm in the journey in my life. I want to thank and honor my parents for how they created me and shaped me, of asking people, what problems can we solve? Because humanity is in need. And who else is best to do that than the folks in the healthcare profession? We have to remember, people come to see us in their most vulnerable state, in need. Sometimes not even wanting you to help them, but they know they need help. So I just ask you to open your hearts and your minds and engage in conversation. Talk to those students, because if we don't exhibit their behavior today, how are we going to be able to rely on them to be there for us in the future? So as I frame up my comments toward the end, this is why summits like this matter. So let's continue to support Health Connect South. This is where issues on the agenda are deep and focused, not just about policy decisions, but discovering opportunities. We talk about expanding high-quality care in both rural and urban settings and everything in between. as we talk about health outcomes for chronic diseases, mental health, which is one of my favorite topics, should be called brain health, maternal health and life expectancy across the region. Also, innovation and technology to accelerate better outcomes for prevention, diagnosis, and ongoing treatment. And in the future, Russ, I would love to have a session focused on taking care of the elderly through the lens of the ICD-10 Z codes. You'll be surprised about how many gaps that we have. So as these are not clinical questions, these are community and economic stabilization questions and issues that we must address. So in closing, the power of partnership and leadership challenge I have for you. Meet 3 to 5 people in the next minute and a half. Ask them what problems are you solving for humanity and how can we work together to solve those problems. Because none of this can happen in isolation. It involves interdependent partnerships with educational institutions, for-profit and nonprofit organizations coming together with our elected officials to begin to make change for humanity. And in closing, I want to say this. October 2016, I had some major life events happen. And as I was watching these life events unfold, I was inspired with this quote. This quote is simply this: I am one human being living in one human race, working to create one humane world. So what are you going to do? Because I know what I'm going to do. I'm going to give my blood, sweat, and tears, just like I did when I was in the military and at the Citadel, to help humanity, because we need a little help right now. So if you would, stand up. Where's Russ? Come on up here, Russ. I need you to do this with me, because this is where the group participation happens. And plus, all the coffee hasn't gone through your system. So Russ issued you a challenge, and I'm issuing you the same challenge. So everybody stand up, and please let's move our bodies and go meet somebody you don't know and ask them, what problems are you trying to solve and how can I help you? Thank you, and have a wonderful, wonderful day. Thank you.